Assessing Sumira's ability to safely mobilize. You notice a walking stick resting next to the sink in her cubicle. You should move the stick closer to Sumira during the assessment. High risk of falls. Falls are the most frequent adverse event reported in hospitals, usually affecting older patients. A fall may have psychological, social, and economic effects in addition to physical effects such as fear of falling, anxiety, depression, loss of self-confidence, a prolonged stay in hospital, and increased healthcare costs. Healy et al. 2008, RCP 2015. All hospitals in NHS organizations will develop risk prevention policies that include fall risk assessment. Fall risk assessment involves the use of risk screening tools aimed at identifying patients at increased risk of falls. Fall risk screening tools may consider risk factors that include the patient's physiological condition, sensory deficits, impaired mobility and/or elimination, mental health status, for example depression, the presence of acute or chronic illnesses, the types, number, and dosage of medications, and past history of falls. Assessing Sumira's ability to safely mobilize. On the assessment form, you will see this box already completed by the admitting nurse. Sumira may have limitations in mobilizing out of bed and may need supervision or assistance to safely mobilize now. Sumira is dependent on her walking aid to safely mobilize, and due to the fact that she is now confused, assistance mobilization is highly recommended. The following risk factors have been identified for Sumira. She has an unsteady gait. She also has osteoarthritis, a disease causing the protective cartilage on the ends of the bones to break down, causing pain, swelling, and stiffness. This means she has a reduced range of movement and an unsteady gait, which increases her chances of falling. She uses a walking aid. Sumira has a walking stick to help take some pressure off the affected joints when mobilizing. Her nurse ensures she has access to an appropriate walking aid on admission to the ward. Leaving Sumira's walking stick out of reach could greatly increase her risk of falls, so do move it closer to her. Sumira may have limitations in mobilizing out of bed and may need supervision or assistance to safely mobilize now. Sumira is dependent on her walking aid to safely mobilize, and due to the fact that she is now confused, assistance mobilizing is highly recommended. Referrals. The physiotherapist can assess Sumira's mobility and teach her relaxation exercises and control techniques if anxious or short of breath. The occupational therapist is able to carry out a risk assessment on Sumira's ability to undertake everyday activity and how she manages carrying them out. The therapist also advises her on specialist equipment to assist with daily activities such as an adjustable bed, walking frame, and bath chairlift. In addition, the occupational therapists themselves also help with her physical rehabilitation, such as assess her cooking meals, washing up, and encourage her to maintain hobbies.